Hello everyone. Today we are going to discuss an important psychological concept called conflict. Conflict is something we all experience in daily life, especially when we have to make decisions. In nursing, understanding conflict is important because it affects mental health, decision making, and patient care. I am Rima Stanley, lecturer at Triple M College of Nursing. Let's begin the topic. By the end of this class, you will be able to define conflict, explain types of conflict, understand internal conflicts, learn methods to resolve frustration and conflict. Keep these objectives in mind as we go ahead. Now, let us see what is conflict. Conflict is a painful emotional state that arises when a person faces two or more opposing desires or choices. Depending on the sources, there are different definitions for conflict, such as disagreement, discrepancies, and frictions that occurs when the action or beliefs of one or more member of the group are unacceptable to one or more other group members and are rejected by them. In simple words, conflict occurs when we feel stuck between choices. Example, a student wants to study but also wants to watch a movie. This creates conflicts. Common causes of conflicts include opposing interests, communication failures, and different values. Conflicts can be unintentional or intentional and sometimes arises when problems are ignored. While often associated with negative violent scenarios, conflicts can be productive, leading to adaptation and progress. Now, let us see the types of conflicts. There are four main types of conflict: approach conflict, avoidance conflict, approach avoidance conflict, multiple approach avoidance conflict. Let us understand each one with examples. The first one is approach conflict. This occurs when we have to choose between two attractive options. Example, choosing between two good job offers. This type of conflict is usually less stressful because both choices are positive. Avoidance conflict. This occurs when we have to choose between two unpleasant situations. Example, doing a difficult assignment or failing the exam. This type of conflict is highly stressful because both options are negative. Approach avoidance conflict. This occurs when one single option has both positive and negative aspects. Example, a highly paying job which is positive but is in a distant location which is negative. This creates confusion and emotional tension. Next is multiple approach avoidance conflict. This is the most complex type. Here, a person must choose between multiple options, each having both positives and negatives. Example, choosing between different career options. This type often leads to maximum stress and indecisions. Conflicts can also be categorized into intrapersonal, interpersonal, and external. Intrapersonal means internal struggle within an individual, example, conflicting emotions or decisions. While interpersonal is disagreements between people, such as differing in goals opinions, or needs, while external conflicts is struggles between individuals, groups, or within nature or society. Now let us see what is internal conflicts. Internal conflicts occurs within the individual. It involves thoughts versus feelings, desires versus responsibilities. Internal conflicts is a psychological, emotional, or moral struggle occurring within a character's mind, often referred to as man versus self. It involves opposing needs, desires, or values, such as choosing between duty and desire, or battling fear, guilt, or insecurity. This internal battle drives character development and creates dramatic tension. Example: a nurse wanting to rest but needing to attend a patient. So, internal conflicts are more harmful as they affect mental peace. Conflicts can lead to stress, anxiety, confusion, poor decision making. If not resolved, it may affect mental health and performance. Now, how do we resolve conflicts? Here are some of the important steps that you can include in your day to day life. First is to identify the problems and try to change the situation. Make proper decisions. Review the situation. Modify goals if needed. Also, there are other helpful methods such as seeking help or guidance, express feeling openly, avoid indecisions, stay calm and think logically. This helps in managing conflicts effectively. From the nursing perspective, conflict may occur between nurse and patient, among healthcare staff, or within the nurse herself, which is called as internal conflict. So, as nurses, you must stay calm, communicate effectively, make ethical decisions. Keynotes: conflict causes stress. Internal conflicts is more harmful. It should be managed or resolved. If not possible, learn to accept and adapt. Seeking help is always important. Before I conclude, conflict is a normal part of life, but how we handle it determines our mental well being. As a nurse, you should recognize conflict, manage it effectively, support patients dealing with conflict. So, proper handling of conflicts lead to better decisions and better care. So, here are a few reflective questions for you. Which type of conflict do you experience most? How do you usually resolve conflicts? Reference: R. Srivani, Psychology for Nurses, and from website NCBI. Thank you for watching this video.